Hello, I am Dr. Indranil Saha. I am infertility and high-risk pregnancy specialist. Today we'll discuss everything that you want to know about the donor sperm IUI, or when we do intra-trial insemination using donor sperm. So first question, why we use donor sperm during intra-trial insemination? The indications are, if the husband doesn't have any sperm in the semen, what we call azoospermia, and they don't want to go or retrieve the sperm available in the testes and have ICSI because that can be very expensive, or they don't want to go through those invasive procedure. Number two, there is very few sperm in the semen, which we call severe oligospermia, and the couple doesn't want to go through ICSI or IVF. Or the husband has certain genetic disease like thalassemia or any other genetic disease that can be transmitted to the baby. In that case, we go for donor sperm IUI. Or if there is a blood group incompatibility, the wife is Rh negative blood group, husband is Rh positive, and the wife developed antibody, that's why she had several miscarriages. In that case, we do donor sperm IUI with the Rh negative blood group semen sample. Or when a single woman wants to fall pregnant, we use donor sperm for IUI. What are the requirements of the donor sperm? Now, ICMR, or Indian Council of Medical Research, has set few rules which all the IVF centers in India follow. First of all, the age of the donor should be between 21 to 45 years. The donor should be screened that there is no infections like HIV, hepatitis B, hepatitis C, syphilis, or any other transmissible disease. The donor is free from any genetic disease, and the donor doesn't have any other familial disease which can be transmitted. The donor should have normal semen analysis as per WHO criteria, and we do take into consideration the blood group of the couple and that of the semen donor, because if the blood group of the husband and wife suppose is O positive, that means if they have a baby, the baby should be O positive. In that case, if we use a donor sample where the donor is A positive or a B positive, and the child turns out to be A positive or B positive, then it will be suspicious that the O positive parents can't give birth to a positive or a B positive baby. Now, the other informations which we share with the couple is that the age of the donor, profession, height, weight, and the eye color, the skin color, and we have all these things in our records and we share them with the couple. Sometimes people ask, do you use fresh sample or a semen sample which is given by a donor on the same day of IUI, or frozen sample? We always use frozen sample. What happens, we get the sample from a donor, we freeze them, and we keep it quarantined for 6 months. After 6 months, we again check the donor. If the donor doesn't have any infections like HIV, hepatitis B or C, then only we give permission to use that sample. So we double check the samples, and we want absolutely safe sample, and any disease shouldn't be transmitted to the woman while we do IUI with the donor sperm. Sometimes we get request from the couple that, doc, we have a friend or we have some relative who wants to be the donor. No, we can't do that, because according to the ICMR guideline, it has to be absolutely confidential and anonymous. No one knows who is the donor is and who is using the sample. Other thing is that sometimes we are asked, my husband has low sperm count, can you mix the sperm, his sperm, and with the donor sperm, and we can have a IUI? In that case, I will think that probably the child is born with my husband's sperm. No, we can't do that, because by law we can't mix two semen sample of different individual while doing IUI. Now, what are the criteria the offspring can know about the donor? The offspring won't be able to know any identifiable informations about the donor, who the donor is, name, address, etc. But the offspring has a right to know about the physical and any other conditions about the donor. Sometimes a couple is very anxious that a donor gives semen sample a lot of time, and then a lot of babies will be born from the donor, and that can be chance of consanguineous marriages. No, we don't do that, because as per as CMR guideline, a donor can give birth to only 10 children, and once that is achieved, we don't use that semen sample anymore. Now there are a checklist which ICMR has given about what information we can share about the donor with the couple, and in every infertility center it is there, and you can always ask the infertility center to share this information with you. Before we do any IUI, a consent form has to be signed by the husband and wife, where it is written that the doctor has explained everything, the risk of the procedure, and the husband will take the legal responsibility of the baby that is born out of donor sperm IUI. Without signing this consent form, we won't be doing any procedure. The most important thing before we do IUI with a donor sperm is counseling the couple. Because whenever we disclose the news that you have to have an IUI with a donor sperm or any other treatment with donor gamete, the first thing the man will feel a sense of guilt, a sense of anger, and he thinks that I am not a man, I'm not able to fulfill my duty, etc., and they have a very low self-esteem. So we give time to the husband to come to terms with that. Sometimes a woman feel a sense of guilt or anxiety, so we give the couple time that you discuss among yourself what you want to do. Some go ahead with the donor sperm IUI, some just want to go through the treatment any further, or they want to go for adoption. It's complete the couple's choice, and if they want, we refer them to a psychologist to discuss this matter in details. Regarding confidentiality, whenever you use donor sample is absolutely confidential. You won't share this information with anyone, and you can rest assured about that. Other thing we discussed during this counseling session is that whether you want to disclose to the unborn child whether the child has been born with a donor sperm. It depends upon the couple. Some couples said no, we don't want to do that, we don't want any complications in our life, and some said no, we want to disclose that in future because the child has right to know who the genetic about the genetic parents, though the identification won't be disclosed. It's completely up to you what you want to do, but again we give you the options and we ask you to think about it before we go for IUI with a donor sperm. The other thing is that a single woman can become pregnant with using donor sperm, and is absolutely permitted by law. But before doing that, again we ask her to go through counseling whether she really wants that, she can afford it, or she is mentally strong enough to raise a child alone. And if she thinks she wants to do that, definitely will go ahead and will do the procedure. Now some people ask about, doc, we want to I want to go through IUI with donor sperm, but please don't tell my husband about it, or please do the IUI of my wife with donor sperm, but don't tell her that it is donor sperm is used. We can't do that, it is illegal. So if we decide to go for IUI with a donor sperm, we explain the couple, we counsel them, we get the consent form signed, and then only we will do the procedure. So I hope whatever you want to know about Intra-Trial insemination with donor sperm, we have discussed almost all the points. If you have any further queries, please subscribe to our channel and write to us. We'll try to answer your queries and clear all your doubts. Thank you very much. Take care.